Welcome to the HealthBeats Podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The HealthBeats Podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakian, and in this week's episode, we're joined by Mr. Rizwan Tufail, Chief Officer in the Data Office of PureHealth. And this week's episode is entitled Leveraging Data for Personalized Healthcare, Shifting the Needle from Reactive to Preventive Care. Rizwan, thank you for joining us.
Thank you for having me.
PureHealth is at the frontier of so many innovations in the way we care for ourselves and others. What are you seeing at that level when it comes to the impact of data-driven personalized care? What does it look like and where do you think it's taking us?
That's a great question. Thank you very much. So look, I think before I talk about PureHealth, maybe I'll take a step back and talk about personalized health. So personalized health, people talk about data being the foundation for personalized health. And generally, the picture that a lot of people will draw is a figure eight with the patient right at the center. And the idea is that as we do diagnostics with the current set of protocols, we understand what is wrong with the person, we collect that data, we collect masses of data. That data that then feeds into the research space. From that research space come precision therapeutics, precision drugs, precision medicines. They come back into the hospital setting or the clinical setting. People use that to, again, diagnose and treat people. And we take that back to, develop better and better drugs. That's all good in theory. That's how it's supposed to work. However, we also know that just in the US, every year, there are about 12 million cases of medical errors. So to me, it seems like we can't really do precision health without an equal emphasis, not only on precision medicine, which gets a lot of attention, but also on precision diagnostics. How are we precisely and accurately understanding what is going on with the individual? Once we do that, only then should we lean onto precision medicine. So that's the underlying sort of virtuous circle that works there. We're definitely in the precision diagnostic space. So we run a number of hospitals across the UAE. We run 150 plus clinics across the UAE. We acquired the largest private healthcare network in the UK. The idea is, as patients come in, we understand their health conditions. That data then is a gold mine for us to work with other research entities to advance the field of medicine, to lean into precision medicine. I also think that there's maybe another sort of circle that should come before that, which is this view just treats you and me as individuals as the recipient of healthcare. Some healthcare is done to us. I fundamentally disagree with that. I think that there's a lot of agency, a lot of power with the individual. What would healthcare look like if we involve the individual into that? I think we can add another circle before that, and I call that the precision prevention. And that is when I know that based on my genetic profile, based on my behavioral profile, I'm actually beginning to get really sort of I have a high risk of developing this condition and this condition and this condition. Now, when I know that, when I sit down with my physician could say, look, if you were to modify your lifestyle, you could actually prevent the onset of some diseases, et cetera, et cetera. Why do we say that? Well, because we know that genetics it contributes to only about 16% of our health outcomes. Mm-hmm. The health system contributes maybe about 30 to 40% of your health. The rest of it is actually determined by our behaviors, by the so-called social determinants of health. So to me, it looks like this precision health journey is incomplete until and unless we engage the individual and we really place an equal emphasis on precision diagnostics.
It's so interesting. No one has more of a stake in prevention than the individual, him or herself.
Exactly.
And so these tools are coming up, data analytics, AI, they're telling us more and more about individual risk factors, preventive measures. What's the state of the art today? How much more can we do to know about what we need to prevent than we could 10 years ago?
Brilliant question. And if I take a step back, I really like what you said. You're placing the individual right at the center, and that's why sometimes I have a bit of a problem with this phrasing of patient-centric health. Well, words have a lot of power. When you call an individual a patient, you've already placed them somewhere in the journey. I would really want to think of person. That's why I really like the personalized health story much of more. Now, to answer your question around where we are, I think we're just scratching the surface. Yes, there is a lot of work happening on precision diagnostics and precision health. We also understand that that's cutting edge. If we really want to change the trajectory of populations across the global north and the south, we really need to think about the equity issue. We really need to think about how those interventions and how those diagnostic methods can be more widely spread, how they can be made more widely available.
Are they
to people.
easy and cheap enough now to go global, or is there still that has to come down as well?
They absolutely are. So one of the most famous sort of researchers in this space, Professor Eric Tufail, talks about how today, with your cell phone and gadgetry that has been customized for the cell phone, high quality medical imaging is actually accessible possible through your mobile without even needing to go into high cost treatments. Now, is that state of the art? Maybe not. Maybe there's a lot of work to be done. However, just think of how it democratizes this deep diagnostic ability for individuals. More importantly, I think one of the bigger problems that we have is if we think that health is something that is being done to a person, we've treated them as a passive recipient of healthcare information. On the other hand, if we empower them with this information and we trust, and obviously a lot of work needs to be done on how do you translate this information? How do you make it accessible to individuals? How do you help them get the insights from a medical image? I don't think we need to make 7 billion radiologists. No, we don't. But we need to make sure that people are able to understand and consume their health information. If we can do that, we're at the verge of something fantastic where longevity is no longer a dream. It is something that is accessible within our lifetimes.
How much can someone like you or I do right now to leverage AI, genomics, to prevent chronic disease, to increase lifespan, health span? What is really and truly useful today?
So again, I think that there is such a lot of advancement happening in the precision diagnostics space. The health systems are doing a lot. And there is most certainly a conversation around how can we bring the individual, the person into that conversation. We need to do more. Generally, when people talk about how can we broaden access to that, I think to this dream of personalized health, I think that there are three deficits that we need to overcome. The first deficit is what I call the data deficit. And there are many dimensions of that. There is this dimension of the quality of data. There is this dimension of the consistency of data. So medical coding in multiple countries is different. How do you ensure that that we are using the same, or at least a universal translation so that we can actually understand this means this in this scenario. So building the trustworthiness, reliability, and integrity of data is really, really important. So that's the data deficit. There is another dimension to the data deficit, which is right now, there is a lot of work happening in terms of data-led medicine that is still being done on data sourced from a particular sort of ethnic background, social background, geographical background. For us to really raise all boats, we need to make sure the data is also representative of the global population that we are. So that's the data deficit. The other is the capacity deficit. So we know that technology systems need to evolve, skills need to evolve. So we need data scientists, we need data governance people. So the skills development agenda that will enable this is definitely there. And the third is the trust deficit.
Right.
And the trust deficit is multifaceted. One of them is awareness. Yes, absolutely. We need to ensure that people are able to consume this information. In the age of AI, we also need to make sure that people understand if the model says something, where is this coming from? So that's the idea of explainability in AI. Can you actually explain why the model makes this prediction or gives you this guidance? And then finally, in the trust deficit, there are some professions that are naturally more risk averse. Healthcare happens to be one of them. My father was an orthopedic surgeon. I actually like the fact that healthcare professionals don't jump at every shining object. They hold back and they ask for evidence of the efficacy. They ensure that there is no harm done from this. So building that trust in the healthcare professionals and the healthcare system is a journey, and we can't give up, or we can't sort of throw up our hands up and say, oh, this is intractable. There are very good reasons why the healthcare ecosystem demands more rigor before it adopts those innovations. It is our responsibility to ensure that we're building that trust through the work that we do.
In the simplest way possible for someone who doesn't know all the mechanics and technology involved, how do you ensure data privacy and security? What is the mechanism, the guardrail?
Yes, so there are a number of things that are done. So first of all, I think that when we think of large-scale analyses, remember when we have these conversations, one is talking about big data, one is talking about records of millions and millions of individuals. There is a tremendous amount of care that is taken to ensure that this data is not identifiable, etc.
But the original data with the person's name on it lives somewhere.
It absolutely does. And precisely to answer that question or to overcome that concern, what is beginning to happen now in healthcare is using large compute power. We take a data that might have, that might have 1,000 variables, might have 3,000 variables. So think of, if like me, you look you sort of understand things visually. Think of an Excel sheet that has, about 2,000 columns and, hundreds of thousands of records. Now take that data set. Today, we have the ability to actually create what we call a synthetic data set that has all the statistical characteristics of that data set, but is actually completely synthetic. So therefore, it is, even if you wanted to, you couldn't actually identify the person back. The data set has all the characteristics that allow the useful application of that, but it is completely synthesized. So that is one of the advancements through which we're ensuring, or the industry is ensuring, the privacy and the security of the individual, while also getting those mass scale analyses and findings that we can use.
So at the end of the day, one can know the likelihood or some element of a propensity for a certain disease area without worrying that your insurance company will know or that your authorities will know. Is that fair to say at this point?
It is fair to say, and I think that field is advancing at a rapid pace. There are a number of models out there. Obviously, in the case of we're sitting in the UAE, we're sitting in Abu Dhabi. In Abu Dhabi, the government, the regulator, has taken a tremendous amount of care to ensure that all the health information for Abu Dhabi is in one central place. There are insights drawn from that, but it is protected and there are no harms to society. So hats off to the Department of Health and its leadership, its regulatory leadership in ensuring that there are no harms done. Same way, the insurance organizations, number of insurance organizations are looking at the data and trying to understand how they can nudge individuals like me to be, to adopt a more healthier lifestyle, et cetera, et cetera. But then there are also completely individualized platforms that are available where, irrespective of the insurance organization, I can actually upload my data, or I could subscribe to that service and build my own sort of view with my own data. And I have complete control over what the insights are telling me. I can decide what insights I want to share, what insights I want to act upon. There's, again, tremendous amount of work happening across the globe. In Estonia, for example, the government has taken the step to build a system where each and every citizen has complete control over their health record. They and they're not only their health record, but all of their unified health information. They can choose to make it available for participation in global research and nationwide research, or they could say, no, this insight is useful to me. I'm going to act on it. I should change my diet. I should change my lifestyle. But the agency is with me. I want to drive that action and not share it with anybody else. Now, the opportunity obviously is if we can build trust in individuals, and you and I are individuals, and our families are individuals. So I say that this with a lot of sort of care. If we can build that confidence in individuals that your information is not going to be used to harm you, your individual information is not going to be used to target you. In fact, it will just help build a societal view of what should be done in this country, in this community to advance longevity and population-wide health. Then we've got citizens as active participants in this dream of precision health.
But for tech skeptics or for low trust individuals, I mean, they see any service they could subscribe to and say, well, how do I know they're not going to change the terms of service, or they're not going to? There's no firm and solid final answer, is there yet?
There is no firm and final answer. I think that this is an evolving space. There is a greater level of responsibility that we as individuals have to understand what the service that we're signing up for is going to do with that. We need to keep up pressure on the private players that we are trusting with our data. We want to make sure that they are intentionally or unintentionally not harming us. So intentionally is if they suddenly change their business model and say, now we're actually going to monetize the data, as happened with a number of genetic profiling organizations. That's a bit of a concern, completely understood. But the industry has evolved where collectively, I have a fair level of confidence that that industry is going in the right way. But the unintentional harm is the hacks, the data breaches. Again, the industry collectively is putting a lot of pressure on that. The requirement for safeguards keeps going up. If a player is playing loose with security, obviously that information is made available very, very quickly. that erodes confidence in that particular player. People then gravitate towards other providers, etc. So over time, we are weeding out the careless actors and just raising the stakes for when you and I can trust our information.
There seems to be an interesting and slightly different health equity issue to discuss when it comes to the frontiers of human health, data, prevention. Right now, if you're an early adopter of technology, if you're well read in and you know what and how the science can work for you, you can do quite a lot to understand your risk profile and to intervene. Biohacking, I think, is a bit of an interesting term, but if you take some of the emotional charge or the aggressive charge away from it, just this idea that you can make these micro adjustments to yourself to live a much longer and happier life. But at this moment, it seems to be very much easiest to access if you're an early adopter of tech, if you're very read in, if you are yourself tech savvy or data savvy. So what does the average individual do to catch up or to make sure they're availing of what they can do for themselves?
That's a great question. It's a huge question. I'll tell you why. Because I think that that what you're talking about has impact not only on health, but many other fields. So if we think of literacy and how it evolved, so think of functional literacy, the ability to read and numbers. Then think of digital literacy, being able to read, and work in a digital format. Then came this idea of web literacy. Then comes this idea of data literacy. With digital, with functional, with digital, if you chose to, for whatever reason, say, I'm just not interested in the web, you could actually sign out and say, I'm just not interested in using the web. I don't need to be a web literate person. I will just stay out of this. The data literacy, the data and AI literacy, unfortunately, just doesn't give you a choice. The reason why, think of election meddling across the world, using deep fakes, using artificially created content, et cetera, et cetera. So the bar in terms of people, the need for people to understand where this content is coming from, can I trust this, et cetera. That bar has been raised. It's been raised not only in healthcare, it's been raised in all aspects of our life.
You can't not understand the technology and live a normal life to some extent.
You can't, right?
Yeah.
Because you're exposing yourself to so many risks from brainwashing in some shape or form, and that and what is at stake is the future of our societies, right? So it's a huge challenge, and we're facing that challenge in healthcare as well. Absolutely, we need to ensure that we can continuously have those conversations with people around us. We can build that trust in, first of all, in the physicians and healthcare professionals that we work with, but then also have those conversations with our parents, with our communities.
And our family,
if we do that.
Yeah. And our family physicians may not be up to speed with the tech.
Completely agreed. So we're creating, people used to talk about it, a two-speed world. Unfortunately, we're creating a multi-speed world.
That's huge.
Where who you depend on, what level of understanding you bring to the table is also different. That's why, this podcast, this event, we need to have more of these conversations. We need to understand the huge potential of precision medicine, of medicine enabled by AI. We also need to have a conversation of what do we need to do to build a rock solid foundation. And it isn't just the technical. It's also just building an awareness and understanding in the folks that we meet and speak.
Rizwan, I'm going to ask you a question that it is not at all fair to make you answer, but let's try and let's see. And because you're in this ecosystem, it's the ecosystem that has to answer this question. As an adult human, you have the things that you ought to do: annual physical, certain screenings over a certain age. As a parent, there are certain things that you ought to do for your child: the regular dental checkup, the physical, the vaccines. But that very set of things to do, the to-do list, seems to be moving and shaped by the technologies as well. To be a responsible parent or to take responsible care of oneself now, one ought to be, make use of these technologies to at least understand how to best care for yourself, to keep yourself alive, to prevent disease. I mean, what is the new checklist? What is the new way to take proper care of oneself and one's dependents? And I'm reminded of that phrase I've heard tossed around a lot, that most people take better care of their cars than they do of their bodies. So what's the new way to think about basic self-care, basic maintenance of one's own health?
That's a great question. It's a big question again.
Yeah.
I don't think there's a checklist. That checklist is evolving. I think what you're pointing to is a fundamental shift in the old paradigm. I'm above a particular age. I go and get my annual screening once a year. The doctor gives me a thumbs up. I come out. I celebrate. I go out, have a big meal, and I'm happy for the next year.
11.5 months. Yes.
Another 11 months before I sort of, give myself that anxiety. I think we're moving from this episodic understanding of our health to a continuous understanding of our health. It's our choice, granted. It's our choice to look at that information. But like with anything, we may choose not to pay attention to the various signs of whether it's our car making some weird sounds and we choose to ignore it and say, well, it isn't time yet for me to go take it to the garage. Or we might say, okay, this is an early sign. I want to do something about it. The same way, we're being given signs every day. It may be as subtle as I'm just not sleeping regularly. Might be as subtle as, 3:00 in the afternoon, I just have this sudden loss of energy. I just get very deflated. I could write that off to, that's just because I had a heavy meal. Well, I could actually begin to experiment and say, no, it isn't related to a meal. It's something else. Now, at that point, I have a choice of, do I want to dig deeper? What is really interesting is that, people use this term citizen scientists. But what is possible today is to turn on our curiosity, our inquisitiveness to say, oh, okay, so I'm seeing this. What does it mean? And I think through the advancements in healthcare and the democratization of health information, we're getting to a point where you and I, the average person, could look at some of those signs, do a lot of research, go and speak to their physician and say, what you're going to observe in the clinic. But here's a body of information that I can bring in that will help you help me better. Right. So not only, what is my heart rate today? Well, actually, my Fitbit tells me that, over time it's been going up or down. There's some wealth of information that I can bring in. And with that information, multiple opportunities.
It's an incredible concept that you're putting forward. There is this talk of citizen scientists. We're talking about citizen data scientists, citizen nursing. This is it's very empowering. And it takes some setup and some conditioning. What do you monitor? Do you use a Fitbit? What are the vitals that you keep your eye on your own self?
Yes. So I do, a Fitbit, Apple Watch, et cetera. I've got my genetic profiling done. Genetic profiling, again, can be done at multiple levels. I opted to go very deep in terms of the profiles. And that told me that in terms of my genetic makeup, one of the things that I'm different than many others is that my body has a bit of a bigger challenge breaking down caffeine. Again, something that I would not have known. Now, armed with that information, I can do a couple of things. I can choose to completely eliminate caffeine, which I haven't been able to do so far. Or I could say, okay, I'm going to have 1 cup of coffee. I'm really going to time it so that I enjoy it the most, so that I can still get the pleasure of that indulgence. But I do it in a very mindful way. And I'll make other adjustments in my life to compensate for that. So it empowers me The challenge is just not to be overwhelmed with that, but to be able to see what can I do with that.
Little tweaks and micro adjustments to yourself.
Micro adjustments that you are in complete control over. The physician doesn't need to tell you. You choose what adjustments you want to make. Because again, longevity and better health is a choice. And if it's a choice, it's a lifestyle change. I think we've got to get away from this idea that I get a list of 5 things that are sort of problematic. I take a medicine for this one, and then I can go on. I think what it's pointing to is that we're empowering individuals to take better control of their life.
Other guests have talked about monitoring their sleep, their heart rate variability.
Absolutely.
Are these now just a given? You got to watch your sleep, your heart rate variability. What steps? Obviously, people talk about their step count. Are these just now standard?
These are standard, of course. Let me be. We are
standard anymore. Yeah.
We're obviously speaking to a self-selected group of individuals here. These are people who are in the healthcare industry. They go and convince others about this. So yes, one could say, well, you're in a bubble. Granted. But I think that bubble is expanding.
And we want to understand what the bubble understands. A lot of people I speak to in this space who are non-diabetics are monitoring their blood glucose levels.
Absolutely.
Now, from, way before any doctor would have told them to do so.
Completely. And that's the really exciting part. In the past, I think, people would have made lifestyle changes once a doctor told them, okay, now you've crossed the threshold. Now you need to change. But what if I could actually do that on a proactive basis and just choose to make those adjustments that I'm comfortable with?
It's a very powerful concept to be able to make those changes. We're here at the Abu Dhabi Global Healthcare Week, the inaugural session. PureHealth has an immense presence here. What are your observations about this conference? How's it been different from other gatherings that you've been to?
So I've really enjoyed the deep conversations. This obviously is much smaller than a number of other conferences that you go to, healthcare focused. It's that's a function of this being the very first one. That's also, I believe, very much by design, because this conversation is meant to be a deeper conversation rather than a very shallow one. That's what I've seen. We at PureHealth are obviously very, very excited, very proud to be a partner to this event. The Department of Health has given us a huge responsibility of care for its citizens through the variety of work that we do. We are the largest healthcare provider in Abu Dhabi. We are the safety net for those residents who cannot, for a variety of reasons, either afford or not get that quality of care. We are their safety net. We take that responsibility and that opportunity very, very seriously. We're privileged to have the opportunity to take care of the population. Therefore, some of the conversations that we're having here about how do we move the entire community forward in terms of being more aware of their health, being able to take more proactive choices about their health. Those are conversations that needed to be had. Those are conversations that we need to have in our communities, with our families. And I think this event is an absolutely correct step in the right direction.
Well, it has been a great pleasure to see you at this event and to have this conversation today. Thank you for joining us.
Thank you.
Thanks for listening. You can like, subscribe, and follow HealthBeats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.